Okay, so how far did we get? So we were just talking about how you look at the spine and things like that, right? So, yeah, so we had covered like some of the more common examples in the previous ones, but what you can do is, if you have a look at this particular one, we're actually looking at a spinous process fracture, okay? So this particular one is called a clay shoveler fracture, all right? So these types of patients, they come in with pain between their shoulder blades, and it's most commonly after shoveling. That's why it's called a clay shoveler fracture. And it's not things that you see every day. It's just things for people just to recognize and see, all right? So it's hyperflexion of the paraspinous muscle. So if you can imagine somebody doing a shoveling motion, they're actually doing this. So they're flexing the paraspinal muscles, and that is actually what eventually causes the fracture along there, all right? So this is what we would call a stable fracture. All right, because it doesn't really affect the spinal cord, right? And most of these are managed conservatively. Okay, so let's try another one. So this is called a burst fracture. And now in this one, what we're actually looking at is we're looking at C1 and C2, what we call an open mouth view. So you'll see this sometimes with C-spine X-rays. We ask for an open mouth view. So the open mouth view actually allows you to look at C1, which is there. You look at C2, which is this one, and then the odontoid pig, which is there, right? Now what happens is C1 and C2, they should be aligned, okay? In this particular one, you can see that C1 overlaps. Can you see? It's like moved away. So the reason for that is C1 actually looks like a ring. It's a donut, all right? So what happens is if you own a ring or if you ever own a ring, it's very difficult to break in one place. It breaks in two places normally when you manufacture it. But if you can imagine this is your ring, as soon as you break it, it starts to move away. So that's basically what's happening here. There's fractures that have taken place, so the C1 starts to move away. So what happens is that you can see there's now this overlap.